Black women face a stark reality in the fight against breast cancer. Despite having similar incidence rates as white women, Black women are 40% more likely to die from the disease. This alarming statistic underscores a pervasive health crisis rooted in systemic inequities. The disparities in breast cancer outcomes are not merely a matter of biology, they are a reflection of deeply ingrained social and economic disparities that disproportionately impact Black women. This essay will delve into the multifaceted reasons behind these disparities, examining the biological, socioeconomic, and healthcare-related factors that contribute to this crisis. We will explore how these factors intersect and create unique challenges for Black women diagnosed with breast cancer, often leading to later diagnoses, more aggressive forms of the disease, and limited access to quality care. While social determinants of health play a significant role, biological factors also contribute to the higher breast cancer mortality rates among Black women. Studies have shown that Black women are more likely to be diagnosed with aggressive subtypes of breast cancer, such as triple-negative breast cancer. These subtypes tend to grow and spread more quickly, making them more difficult to treat. Furthermore, Black women often develop breast cancer at a younger age than white women. This early onset poses additional challenges, as younger women are less likely to undergo regular screenings and may face different treatment options and side effects. The complex interplay of genetics, lifestyle, and environmental factors requires further research to fully understand their impact on breast cancer disparities. Socioeconomic factors are deeply intertwined with breast cancer outcomes. Black women are disproportionately affected by poverty, lack of access to quality education, and residential segregation. These factors can significantly impact their ability to access preventative care, early detection services, and timely treatment. Financial constraints often prevent Black women from affording mammograms, biopsies, and other essential diagnostic procedures. Additionally, transportation barriers, lack of health insurance, and childcare responsibilities can further impede their ability to seek timely medical attention. These systemic barriers create significant obstacles in the fight against breast cancer, leading to delayed diagnoses and poorer outcomes. Section 4. Healthcare disparities, unequal access, unequal outcomes. Even when Black women can access healthcare, they often face disparities in the quality of care they receive. Studies have documented racial bias in the healthcare system, leading to implicit biases in diagnosis, treatment recommendations, and overall patient care. Black women may encounter skepticism from healthcare providers regarding their symptoms, leading to misdiagnoses or delayed referrals to specialists. They may also experience communication barriers, cultural insensitivity, and a lack of trust in the healthcare system, further hindering their ability to receive optimal care. These disparities highlight the urgent need for culturally competent healthcare providers and a more equitable healthcare system that addresses the unique needs of Black women. Section 5. The urgency of action, bridging the gap in breast cancer care. Addressing the disparities in breast cancer outcomes for Black women requires a multifaceted approach that tackles both the biological and social determinants of health. We must invest in research to better understand the aggressive subtypes of breast cancer prevalent among Black women and develop targeted treatments. Equally important is dismantling the systemic barriers that prevent Black women from accessing quality healthcare. This includes expanding access to affordable health insurance, improving access to transportation and childcare services, and addressing implicit bias in the healthcare system. We must also empower Black women with knowledge about breast cancer risks, early detection methods, and their right to advocate for their health needs. Section 6. Empowering change, a call for awareness and advocacy. The fight for health equity requires a collective effort. We must raise awareness about the disparities in breast cancer outcomes for Black women and advocate for policies and programs that address these inequities. This includes supporting organizations that provide breast cancer screenings, education, and support services to underserved communities. By working together, we can create a future where all women, regardless of race, have an equal opportunity to live long and healthy lives free from the threat of breast cancer.